Hi there, Jen Broyles here. So recently I shared with you that I had a SIBO relapse, and again, SIBO stands for small intestinal bacterial overgrowth. So essentially it is a bacterial infection in the small intestine in which bacteria from the colon starts to overgrow in the small intestine, cause a bunch of uncomfortable symptoms such as bloating, diarrhea, constipation, abdominal pain, and a whole host of other problems. And so that is what I found out I had or still had. And at the time, I really don't know if it was an actual relapse or if I just never got rid of it completely because I didn't retest at that time. And so it's hard to really know. But the fact is, I had SIBO and had to kind of retreat it. And so I shared that I did a 60-day herbal protocol, and it was a protocol that my doctor recommended for me. And throughout the protocol, I had periods of improvement and periods of not feeling so well. And by the end of the protocol, my symptoms were pretty much the same. They hadn't really improved that much. And so my concern was that the SIBO was still there, or either something else is causing the problem. And I don't really know until I retest, and that's why I always emphasize the importance of retesting so you can really know where you're at and what next steps you need to take. So I retested for SIBO using the lactulose breath test, and the test came back positive. And so now I am having to start a new treatment. And instead of doing an herbal option, I'm going to go with a pharmaceutical option this time. And fortunately, there are several options out there for SIBO treatment. You know, there are a couple of pharmaceutical options in the form of antibiotics. There are several different herbal options. And so, you know, trying out different herbal options can be very, very helpful. And then there's the elemental diet, which is usually the last resort because it is the most difficult one to do. So, you know, I've done a couple of herbal protocols in the past, and those have not helped me. I could try another herbal protocol, but I'm at the point now where I'd like to try the pharmaceutical option because it's been shown in studies to be so effective. And in terms of antibiotics, these antibiotics seem to be pretty safe. And the reason is because they work only in the intestines where they're intended to work, and they're not shown to cause really any systemic side effects like urinary tract infections or anything like that. And one of the antibiotics that's used is actually shown to not cause antibiotic resistance and actually be anti-inflammatory. So that's encouraging as well. So while I don't like antibiotics, these seem to be more on the safe side. So the protocol I'm actually about halfway through, is a combination of rifaximin and neomycin, and I'll do it for 10 days. And there are a couple of pharmaceutical options out there, and it really depends what your symptoms are and what your test results show to determine which pharmaceutical option to go with. So if your breath test shows that you're high in hydrogen production and your symptoms are primarily diarrhea, then you would typically take just rifaximin. Rifaximin alone for that type of SIBO seems to be very effective. And if your breath test shows that you're high in methane and your primary symptom is constipation, then you need to do 2 antibiotics. You would likely do rifaximin plus neomycin. That combination has been studied and has been shown to be very effective. And so that is the protocol that I am doing this time. And I'll do 550 milligrams of rifaximin 3 times a day and 500 milligrams of neomycin twice a day. And I think I mentioned, I'm about halfway through the protocol already, and I've already noticed improvement, which is very, very encouraging. So I'll do it for 10 days, and then at the end, I'll retest. And you want to make sure you retest within 5 to 10 days after you complete any protocol, whether it's herbal or pharmaceutical. And then from there, assuming my test is negative, I will go into a prevention phase. And that will consist of a combination of diet, which I've talked to you about before, as well as prokinetic. And I'll just share some of the things that I learned a few months ago when I attended the SIBO symposium up in Portland, Oregon. I heard from great speakers like Dr. Allison Seebecker and Dr. Mark Pimentel that have devoted their careers to IBS and SIBO. And so they talked a lot about prokinetics and the importance of prokinetics in SIBO prevention. And there are several different prokinetic options out there. A couple pharmaceutical options, a couple natural options. But assuming my test is negative, then I will start taking a prokinetic. And the pharmaceutical options are low-dose naltrexone, which, according to what I've learned from Dr. Seebecker and Dr. Pimentel, it does work for some people, but a lot of times it's not strong enough. And so some people will combine it with another prokinetic or just try a completely different prokinetic altogether. Another option that seems to be very popular and is shown to be very effective is low-dose erythromycin. And then the third pharmaceutical option is Resilor. And I know several doctors are big fans of Resilor. It seems to be the strongest, seems to work really well, especially for people that have methane-positive SIBO and struggle with chronic constipation. Resilor seems to work well in those cases, according to what I learned at the SIBO symposium. And some natural prokinetic options are Iberogast, which I've tried, and I personally did not experience much improvement with it, but a lot of people really like it. Another one is called Modal Pro, and that is a combination of ginger and 5-HTP. It works great for some people, and it causes some uncomfortable symptoms in others. So again, try it out and see if it works for you. A third one is just taking ginger capsules. And again, sometimes that causes some burning sensations in people, other times it works. So again, when it comes to prokinetics, just like with the SIBO treatment, a lot of times it's trial and error and finding what exactly works for you. But you'll want to be on a prokinetic based on the research and recommendations from Dr. Seebecker and Dr. Pimentel and some of the other doctors. You'll want to be on a prokinetic for at least 3 months, and for some people it's long-term. And then, of course, you'll need to be on a maintenance prevention diet, usually some type of low FODMAP, low fermentation diet. Some people really need to get a little more strict with it and do like a combination of SCD with low FODMAPs. That seems to work really well, but again, it is a more strict version. But again, trial and error. I think it's best to just pick a diet, and try it out, stick with it, and see how it works for you. And as with anything, you're going to need to tweak it and customize it to work for you. But use it as a guide, and then start customizing things over time and find what works best for you. So again, just to kind of recap, if you're experiencing some of this and you're trying to find the answer and a good treatment option, again, a lot of times it takes trial and error, but there are great pharmaceutical and natural options out there. Be sure to test and retest every time. That's the only way you're going to know where you're at and what next steps you need to take. And then once you've cleared your SIBO, just make sure you go into a prevention diet and add in a prokinetic so you can prevent a relapse of SIBO. And another thing I want to mention as well is if you take magnesium on a regular basis, be sure to stop taking the magnesium before you retest. I just learned that recently, that magnesium, if you're taking it while you're retesting, like while you're doing the breath test, that it can actually cause a false negative test. It can cause the numbers to be falsely low. So you want to stop the magnesium at least 4 days before, and that's something I learned as well through Dr. Seebecker. So just a few a few pointers there that I hope can help you out, and I will be sure to keep you posted on my progress as well. Thanks.